Hey everyone, my name is Sarah Johnson and I'm a pediatric occupational therapist and part of the infant development team here at Emerge Pediatric Therapy. Our infant development team is made up of therapists who have experience and expertise in working with infants, and I'm here today to talk to you about the use of infant containers and which ones support infants' development more than others. As parents and caregivers, I recognize that there is a lot of information out there about best devices for babies. There's a lot of recommendations on parent groups or for family friends. And my hope today is to go over some of those popular baby devices or containers and provide you with ways to use them that support infants' most natural development, and also to provide some guidelines on what some of our favorite devices are as opposed to other ones. I absolutely understand that there are times during the day that you may need to use a container, whether it's due to animals in the house, a toddler running around, needing to do some cooking or cleaning, or some self-care for yourself. So my hope today is that I'll provide you with some information that can help you make an informed decision on what the best devices for you and your family might be. The first thing I'm going to talk about today is container baby syndrome, or CBS. And this is a syndrome used to describe issues seen in infants who spend too much time in devices that inhibit their movement. Container baby syndrome is typically seen in infants below a year of age, and it's most prevalent in those 0 to 5 months. And a lot of times it's seen when infants spend a lot of time in positioning devices or containers. And just to clarify a little bit what I mean by that, I'm talking about car seats, swings, bouncer seats, bumbo seats, exercisers, and walkers. Anything that kind of holds your infant in a position for a period of time. A lot of times these containers are used to keep children safe and to keep them more accessible to caregivers, but there are some guidelines that we can follow just to make sure that we're not having infants in them for too long and can provide them with other opportunities to move around. A lot of times infants seem to really enjoy these containers. They are at a great position to make eye contact with us. They might be smiling or cooing back and forth, and they might show some fussiness when we then transition them to the floor for tummy time, because it is a lot of work for them. They have to push up on their arms and work on lifting their head, but really those are the milestones that we want them to be working on, and though it is hard, that is really important for their development. Many parents and caregivers follow the American Academy of Pediatrics Back to Sleep campaign, which talks about safe sleep positions of baby being in a face-up position. A lot of parents and caregivers have also interpreted this to mean that face-up is the best position for play during the day. And actually, when infants aren't sleeping, we really want to be engaging them in moving in all different ways, especially on their tummy, to strengthen their head and neck muscles that all correlate with later motor milestones. So as much as possible, we really want them to be on the floor and moving around and engaging all those different muscle groups. So there are a few important things to consider if you're planning to use containers. The first thing is to make sure that the infant's head and neck are in midline. So that is kind of that straight up positioning, not tilted to either side. If you put your infant in a device, such as a swing or bouncer seat, and you notice their head tilting to one side, you do want to try to get that back to midline by using a towel roll or a small pillow. Just be mindful that when using those in addition to the swing, that can be a suffocation risk. So we always want to supervise infants during that time. When possible, we want to limit the duration of container use to 10 to 15 minute increments and try to only do this 2 or 3 times a day. One important thing to consider is that a car seat is considered a container because it does inhibit the infant's natural movement. And obviously car seats are very necessary when a child is in the car. But if your infant has been in the car for longer than 20 minutes or multiple times during the day, we really want to be careful of other container use during that day so that it's not too much for the infant. I always like to tell parents to follow the double rule. For the amount of time your child is in a container, double that with unrestricted floor time. Now this can be positioned on their tummy, their back, or even on their side, as long as they are in a spot on the floor that they can move around and are not locked into one specific place. We also want to be mindful of positions that are developmentally appropriate for infants. If you put your infant in a seated device and they automatically slump forward and their head is tucked in, maybe they're not yet ready for that seating device. The same thing with walkers and standers. If you do provide your infant with supported standing, we want to make sure that their feet are flat and not on their tiptoes. And this is a little different from what you see on the packaging, which a lot of time is infant on their tiptoes, but we want to support that flat foot, which is best for future walking. So I will now go through some specific baby containers and provide recommendations. Remember that these are just recommendations. Each infant is different, each family is different, and kind of your circumstances are different based on day to day. So these are just some basic recommendations to really help you to find the best device for your infant. So the first one is the infant swing, and these can be used for 10 to 15 minute increments if parents need to get something done around the house or kind of put baby down for a minute. The American Academy of Pediatrics does recommend that in infants younger than 4 months, they be in the farthest reclined position, and this is due to the potential suffocation risk of them kind of slumping forward. So make sure that they are fully reclined if they're under 4 months in an infant swing. Another important thing to note is that a swing is not considered a safe sleep surface per the Back to Sleep campaign. So if your infant does fall asleep in a swing, it is recommended that you move them to a firm sleep surface. The guidelines for bouncer seats are very similar to swings. It's recommended to only use for 10 to 15 minute increments. When an infant is good at sitting up or is around 20 pounds, you should discontinue use of a bouncer seat. And we want to be especially mindful of infants who have plagiocephaly or a flat spot on their head. When they are placed in infant swings or bouncer seats, they tend to attain a preferred position that's on their flat spot. And we just want to be really mindful of the time spent in these devices so that we don't further the development of that flat spot. The next device that I want to talk to you about is the bumbo seat. And the bumbo seat is a very popular infant device right now. And actually, to talk about some of the appropriateness of this device, I do want to read a quote from their website. The Bumbo website states, "The Bumbo floor seat was designed to seat young babies who can't sit up themselves yet." It also states, "As soon as your baby can support their head on their own, you can seat them in the Bumbo floor seat." When children are placed in the Bumbo floor seat before they are developmentally ready for sitting, it can interfere with the natural progression of skills. If you actually observe a child sitting in a bumbo, you'll notice that they are in a position that locks them in and doesn't allow them to activate their core muscles. They're typically tilted a little bit forward, and because they are locked into that position, they're not having any active muscle control, so they're not developing those skills to work on sitting. My recommendation is to avoid using the bumbo seat or to use it sparingly. If you are choosing to use it, make sure your infant has good head and neck control prior to put them in this device. If you need to use it to keep your baby safe during cooking or cleaning, try to either put your infant positioned on the floor, laying on their back or on their belly, or even seated using a boppy pillow. A lot of time infants that are below 5 months of age will pretty much stay in one position since they're not yet rolling. So a lot of times you can put those young infants on the floor or in a playpen or a pack and play so that they're safe, but they're able to move around while you're working on doing various things around the home. If you're using this device for feeding, I would recommend using a high chair with foot support instead, because we do want to be really mindful of the hip and knee alignment during feeding and making sure that we get those 90-degree angles, and that really is not possible with the bumbo seat. The fluorocytmia is another popular baby device, and this container is really dependent on your infant's age and also their size. For some infants who are young or small, the bar in front of the fluorocytmia can be too high, and that inhibits them from bringing their hands to midline to really engage with activities, which is one of the milestones we want them to be achieving that day. One thing we are looking at, if we're comparing this to the bumbo, the fluorocytmia does provide better leg support and does put them in a better position overall. But I would recommend using a boppy pillow behind their hips instead. And this is something that we will go over in subsequent videos on really some other ways to use supported seating that's not in so much of a device. Extra saucers are a safer alternative to walkers, though there are still some concerns when we're looking at the use of extra saucers. And the two main things we look at with these are poor positioning and poor balance control. When babies are placed in extra saucers, they have a tendency to shift into a position that pushes their head back, their hips are far apart, and their back is arched as their belly leans forward. And this is really just not an ideal position for them when they're looking at developing those walking skills, because that's not the position they'll be in when they're actually walking. We also want to look at their balance control. So when babies spend time in extra saucers and they don't have good trunk control, they are looking to kind of find their center of balance and doing those compensatory strategies like arching their back. And over time, they're not developing that good balance control, which is really a precursor to walking. A lot of skill development with balance control is being able to see their feet. So when they're working on those standing postures, being able to look down and see their feet, and that is actually a precursor for their walking. So there are some concerns about that as well with extra saucers. If using an extra saucer, you do want to make sure that your infant's feet are positioned in a flat position, not in the tiptoe position, because this is what will encourage future development of those walking skills. Jumpers and walkers are another big infant device that is very widespread used, and I want to talk a little bit about the specifics of some of these. First of all, when I'm talking about walkers, I'm talking about the devices you put infants in to walk, not the push toys that infants use when they're working on walking on their own. The American Academy of Pediatrics actually recommends a ban on the sale of mobile infant walkers, and they've actually already been banned in Canada. The research does state that these walkers do not encourage early walking, and in fact, there are some cases of them delaying motor development. So that is important to keep in mind, that these are really not assisting with the early development of walking and could be delaying your infant's walking a little bit as well. I also do not recommend jumpers, and these include the Johnny Jump Up, the Jumperoo, and the Jump and Go. And the reason for this is really the positioning of the hips and the force on the hips as the baby's hips are still developing. The International Hip Dysplasia Institute noted that an increase in hip dysplasia in babies that misuse or overuse various baby devices. And these include baby carriers, jumpers, extra saucers, walkers, and molded seating items. These put infants in an unhealthy position, especially when used for long periods of time. So just be really cautious with these devices. Really watch how your infant's responding and really just watch how their hips are over time. These would be ones that I would really recommend if you're going to use only using for 10 to 15 minutes once a day and really trying to limit the time overall in these devices. A lot of times I hear caregivers say that their infants love their containers so much and that they really seem to enjoy being in them. And then when we're kind of talking about decreasing that container use, it can be hard when it does seem like the infant is enjoying it. One important thing to note is to find the aspect of using a container that your infant enjoys and work on other ways to incorporate that. So if it truly is the position that your infant is enjoying, such as the sitting or standing, find ways to provide that position that is more dynamic. So they are doing it on the floor or with you and kind of getting the opportunity to move around in those positions. The same thing if there's a particular toy the infant likes playing with that's on the walker or on one of the seating systems. A lot of times you can adapt that so that your infant can sit on the floor and reach and play with it, and then that can promote some other skill development as well. It is also important to note that you do not need containers to teach your infant a skill. A lot of infant containers are marketed to help your infant learn how to sit, stand, or walk. But actually the best way to promote the development of these skills is unrestricted floor time. And that can mean on their back, their belly, or on their side. But the more important thing with infant development is providing a safe and engaging environment for infants to move around. The more they're moving around, they're learning how their bodies work and they're developing all those future motor skills. I hope this information has been useful in helping you determine when and how to use infant containers. This is my recommendation based on evidence-based practice, but I do recognize that there are times when you may need to use containers, and I hope that the information provided today will allow you to make an informed decision that is best for your infant and family. If you have any concerns about your infant's development, whether it be with their motor milestones, fine motor skills, feeding, or general infant development, please give us a call. I would be more than happy to speak with you about your infant's concerns and decide if infant pediatric therapy would be the right fit for you. Thank you so much.